Let's talk about psychiatric disorders in pregnancy. All psychotropic medications studied can cross the placenta and are present in the breast milk and amniotic fluids. Medication with fewer metabolites, higher protein binding will have less placental passage. So for major depressive disorders, it says 15% pregnant women fulfilled criteria for major depressive disorders. Untreated maternal depression, especially in the second or third trimester, can cause preterm delivery, SGA, FGR, postnatal complications. Children with depressed mother are more prone to have suicides, conduct problems, and emotional instability. Here says 68% of patients who discontinued their antidepressant relapse during pregnancy, 25% who would continue antidepressant during pregnancy relapse. Postpartum depression, major episodes of depression within 6 weeks of delivery. Treatment, SSRI. Limited evidence on teratogenous effects or adverse effects from breastfeeding. Paroxetine in first trimester possibly cause cardiac malformation, anencephaly, cranial synostosis, and omphalocele, albeit very rare. Avoid paroxetine during pregnancy. If exposed, need fetal echo. Sertraline can be associated with omphalocele and atrial and ventricular septal defects. This is considered first line. TCA, possible limb abnormalities, no significant link between prenatal exposure and perinatal complication. Safe for breastfeeding. Atypical antipsychotic. Bupropion, duloxetine, and venlafaxine. That's an SNRI. No found adverse events. ECT effective and safe during pregnancy. Breastfeeding is okay, very low amount expressed in milk. Bipolar disorder, I think it was said 5% in pregnancies, high rates of recurrence. Treatment, lithium, 400 times cardiac anomalies, especially Epstein anomaly, neonatal toxicity, flaccidity, lethargy, poor suck reflex greater than 7 days, no long-term neurobehavioral sequelae. Abrupt DC of lithium associated with high risk of relapse. Mild to infrequent episodes. Lithium is tapered and stopped prior to conception. Moderate risk for relapse, tapered and stopped prior to conception and restarted after organogenesis. Severe or high risk for relapse. Continue lithium with counseling. Do a fetal echo. And is not recommended during breastfeeding. Anti-epileptic, valproate, carbamazepine, lamotrigine. The lamotrigine is first line. Valproate definitely not being used anymore. Neural tube defects, craniofacial anomaly, cardiovascular abnormality, facial abnormality. Craniofacial includes facial. Mental delay, autism, Asperger, neonatal hepatotoxicity, coagulopathy, hypoglycemia. Okay to breastfeed. Interesting. Carbamazine, facial dysmorphism, fingernail hypoplasia. Probably safe during breastfeeding. Lamotrigine is rare midline facial clefts, relatively safe compared to the other two. Phenytoin can cause hydantoin syndrome. Anxiety disorder, panic disorder more likely in the postpartum period. OCD can worsen in the postpartum period. Treatment, benzodiazepine. It's not first line anymore. Because floppy infant syndrome, hypothermia, lethargy, poor respiratory effort, and withdrawal symptoms, restlessness, hypertonia, hyperreflexia, tremor, diarrhea, vomiting, apnea. Schizophrenia itself can cause congenital malformation, especially cardiovascular. It can also cause preterm delivery, small gestational age, placental abnormalities, antenatal hemorrhage, postnatal death. Treatment, atypical antipsychotics, clozapine, olanzapine, quetiapine, risperidone. First line for negative symptoms, high rates of SGA, SAB, typical antipsychotics, haloperidol. Thyroidazine. No teratogenic effects documented. Fetal and neonatal toxicity, neuroleptic malignant syndrome, dyskinesia, extrapyramidal side effects, heightened muscle tone, increased rooting and tendon reflex, neonatal jaundice, postnatal intestinal obstruction, exposure to drugs for management of expyramidal side effects, diphenhydramine, benztropine, which can also cause oral cleft. There's no winning. Switching meds is not recommended since it exposes fetus to both meds.